I mentioned map of medicine, and this is what the map of medicine pathway looks like, and this is actually for chronic low back pain. You can print it out. It's got greens, and then if you get referred, this green turns to blue. So if you get referred from primary care into a hospital setting, you can actually see. And what that's doing is telling you what pathway we should go through to support you with back pain. So here it's saying chronic low back pain. Do you have alarm symptoms? If you click on the I button, it will tell you what the alarm symptoms are. Alarm symptoms present, transfer immediately to A&E for evaluation. As a patient, what that means is if they know they've got back pain and they've got that, and it's saying A&E, then that's giving them permission to ring 999 so that they can just get on and go there. That's how we make the services more appropriate, by allowing you to see it. If there aren't any, well, this is the history, this is the examination, these are the other conditions that we might want to consider. This has been designed for doctors and nurses, but is available for patients to look at. One of the interesting things is that people have said to me, well, because it's designed for doctors and nurses, patients aren't going to be able to understand it. Well, that's partially true if you've never suffered with back pain, but actually it's amazing how when you do suffer with back pain, some of the terms that are being used here are terms that you've come across, or they mean something to you, or you've done a Google search and already know something about it. So I've found it's been very helpful for me. Okay, now let's go to the EMIS Access and what happens when patients access their medical records. But once you put your passwords in, and you want to order your repeat prescriptions, this is the screen that you get. It tells you about them, and this comes straight off the repeats that we've typed onto the computer. So as clinicians, we don't actually do anything different, we just continue doing what we're doing. And all the system is doing is pulling the data out and making it available for patients to see. So this is the repeat screen. This describes how to take it, and this describes when it was last issued. So you can see, for instance, that the GTN was issued on the 2nd of June, but you can see over here that this particular tablet, that's erythromycin, let's take another one, Monomil XL, was last issued in October 2008. Now the question that one would ask is, well, why do they not continue to take it? And often I find that patients themselves might not necessarily know why they're taking the medications or what it's about. But if someone else could see that they haven't ordered that tablet for 6 months, it might trigger a question for them before that patient ends up in A&E because they've not been taking their tablets. You'll see next to each tablet there's a little I button, and if you click on the I button, it will take you to a website that tells you a lot more about that particular tablet. This example is aspirin, and you can save it as a PDF or you can print it. Patients who are ordering repeat prescriptions online think this is absolutely fantastic, and they've learned a huge amount of information. Interestingly, it hasn't belittled the conversations that they're having with their doctors or nurses. They've never said, why has my doctor or nurse never said this? What they've tended to say is, gosh, I've had this condition for 20 years, I've been on this tablet for 20 years, and the internet's told me stuff I never knew about that particular thing. So it supports their understanding rather than creating problems.
Many people coming in asking about side effects and sort of contraindications.
No, quite the opposite actually, because they can see it. And actually the side effects and contraindications are the very same things that are in the leaflet anyway. What I found is that they find it's just much easier to read than the little writing on the page. But no, I haven't seen any increase in people saying, I've been on the internet and seen this thing, and something tells me about it. They have noticed interactions though. The interactions bit they seem to find better at reading, which they find very difficult on those leaflets. That's the one.
Sorry, I'm just wondering, what's your experience about people, probably with all this information, trying to get ahead in the referral system? For example, back pain. Some people who just believe, look, this needs to be sorted out, and they say, look, I have these alarm symptoms, I have this, because they know exactly what you're going to do next.
It's no different to the patient that's read something in the Daily Telegraph and comes in and says, I know a little bit more, than the next patient who just doesn't read anything. And, you know, we're now in the information age. It's no different to someone who's spent an hour, 2 hours on Google, found a website that gives them information that says, maybe I've got this, that and the other doc. The problem is that it's very hit and miss. 2 days ago, I had a patient who came in and said, Doc, I've heard about this new tablet that purifies something from tomatoes. Can I have that? And I'd never heard of it. I said, what are you talking about? Oh, it's all over the news. I said, I've never heard of it. So the next day, in my tray, was this 5 pages of stuff that he printed off from the BBC News website about someone who purified something in tomatoes, and some experts saying how wonderful it was. And you know, at the moment, people are going to anything at all. What I'm doing, and what I'm encouraging patients to do, is let's go to NHS Choices, let's go to the map of medicine, let's go to the page that I'm reading, So that actually when you come in and say the map of medicine suggests that I need a CT scan or I need to be referred, I say, oh, thank you. You're following evidence-based medicine. The very tools that I'm using to help deliver care, you're telling me where you think. My job just then becomes, is this right? Is it true that that's the history and that's the examination? You know, has the patient got the understanding right? But actually what I find is it saves me huge amounts of time. Instead of me having to do it all, patients have done it and said, this is where I am, this is what I think I should be, can I have that? Booking appointments. We've got appointments booked up to 6 weeks in advance and patients just love it. You know, instead of ringing up on the front desk and just being given the next available appointment, they can actually choose very carefully and sit down with their family and just pick whichever appointment they want. When they do go into the full access to the full record, this is the screen that you get, so you can see the allergies, what medications, repeats. Down the side you've got the summary record, the consultations, results, letters, medication, reports, and so on. As we move further down, this is a significant active problem list, and notice how they've got the conditions in chronological order, and again next to each one there's a little information button, so they can go to websites that tell them more about obesity, asthma, or whatever else it might be. We've also got it in system order because feedback from patients was that they found this information quite difficult to understand. They found it easier to say, this is my chest problem, this is my nervous system problem, this is my heart problem, and so on. So it reorganises it in a form that patients find more easy to understand. And then family history. Again, that might be useful if that patient was to present that record in the A&E department or the out-of-hours department, and you knew that this is a patient who's got a family history of diabetes or heart disease. It starts to get you as a clinician to start thinking a little bit more about, could this be some sort of odd presentation from one of those things. It's potentially useful information. And then the most recent test results. Consultations, when they click on consultations, this is the information that they get. So for instance over here, this is a consultation that the test patient has had on the 8th of June with me, it's renal failure. I've written in the comments in the free text, blood test going off, not sure why, has been under the rheumatologist for a while, email them and ask if they need to be seen urgently in the clinic or not. But if that's the 8th of June and this particular patient presents to you as an immediately necessary and says, by the way, do you want to see my record? And you can see that, you've then 3 steps further ahead because you then know what I'm up to. You know that, you know, which doctor it is, so if you need to speak to me, you can contact me or ring up the surgery or whatever it might be. And you can ask the question, well, which rheumatologist are you under? And that's where the patient access to records becomes very, very powerful because it's somebody else who can see that information. Of course, the other one is the patient can see it as well, so they're now on my page as well. And they now know, gosh, doctor doesn't really know why this is, but it must be serious if he's emailing and not just writing a letter, for instance. That's when you click on the I button for that, renal failure unspecified, this is what you get. So again, it's not a Google search with 10,000 websites to look at. It's a handful of websites, all of which have been vouched for, which give you more information about it. Letters, test results. We talked about test results and patients having access to them. This is what it looks like. And you can see their cholesterol, what the result is, what the normal range is. Do you use Catholic? Do you use the IT system to file? Yeah, so when you type in a message, you know, abnormal or needs appointment or whatever, that free text goes there. So the patient can see that cholesterol, abnormal, and again there's a little I button there. The screen that you can see now is the new screen at the moment, and they're still developing it. But what I've done is I've just switched over